Hey guys, I wanted to come on and make a serious video about my experience with the Nipt test and positive Trisomy 21 result. And I want to talk a little bit about things. So let's get started. When I was 12 weeks along, we did the Nipt test, and you guys, I'm going to just be real raw with it. Like I'm not a politically correct person all the time, so I guess I don't really know the lingo. I feel bad saying things like normal baby or typical baby versus a baby with Down syndrome. Like I don't really know how else to word it or what is the correct way to word it. I don't think there's anything wrong with babies with Down syndrome, and I want to make that clear, or any kind of syndrome or any kind of chromosome thing. But I really just want to talk about my experience with the test, a lot of things I've learned along the way researching it, some of the things I've seen that are disturbing, I'm going to give a lot of opinion on this one. I want to give some opinion on how I feel, like some tips on maybe how to help you process it, and maybe some things that will help you process it, because I'm going to tell you like how I got through it, and some things I saw that were disturbing, alarming. And there's going to be some graphic stuff. Like I'm going to go into TMFR. I'm going to talk about things like abortion. So I'm going to go into detail about what I was told, my experience with the genetic counselor, my experience with my maternal fetal medicine doctor. And I just want to say, the reason I split this into two videos, my last video was just like an update, like 24-week pregnant update, like 44 years old, geriatric pregnancy. You know, I'm older, obviously, it's a natural pregnancy. And I didn't want to take away from the experience of being pregnant with the negativity. Like I really tried to compartmentalize that, and like it is so easy to get caught up in it and not enjoy your pregnancy at all. And honestly, I'm guilty of that. For a couple weeks, I was definitely guilty of that. And I'm gonna be honest with you about some of the like darkest things that I said to my husband, that I thought, that I said out loud. Like I'm gonna tell you the whole truth so you can kind of understand like how this whole thing goes. Now, you can get a Nipt test. It's Nipt. You can get them at 10 weeks. Usually if your doctor has a brain, like he will understand that if you're heavier, like if you're over 200 pounds, you probably want to wait until 12. And if you're a bigger girl, you probably want to wait until you're like 14 weeks to get the Nipt test, because they use the DNA, the baby's DNA that's running through the mother's bloodstream. So it's all about the ratio, right? So my ratio was, I believe, 5.4. It could be 5.1, but I believe, I don't have it right in front of me. If you don't get over 2, you really can't test. Now, there are some people who are further along, who are healthy, skinny, fit body weight, who get a low, it's called a fetal fraction, this percentage. So they can pull a low fetal fraction. Like if you're 12 weeks along and you're a normal body weight and you only get a fetal fraction of 1.5, you automatically get thrown into a high risk category, because there might be something wrong. Usually it's like a trisomy 18 or trisomy 13. They might not even know which one. They might mark you high for both. I'm just giving you the information that I have found about researching. While researching these tests, like this is what I found out. So my fetal fraction wasn't low. Anything over 2, like even with a 3 or 4, they can still test it. But the thing is that a good amount is usually 10, 12, 14%. That's what they really like to have. Now mine was 5. So what that tells me is that it's enough to test. The test is probably fine. It's enough. But my risk of getting a false positive result, meaning them telling me that my baby has a chromosomal abnormality and it being inaccurate, is greater, because my fetal fraction rate is lower, right? Plus I'm heavier. So 5, but the thing is 5, 5.4, 5.1, 5.6, whatever it is enough. You know, it's still relatively reliable. They're not gonna say, come back and do it in 2 weeks. We couldn't get a read. They did tell me that the baby was a boy and that I was high risk for Trisomy 21, which is Down syndrome. What I will say is that it's conflicting for me, right? Because this test is very, like 98% accurate when it comes to Trisomy 21. So I understand that, right? Like I totally get it. But it's not 100%, and you just never really know. And the other thing too is that when you look at the test, they do like a predictive value, like it's called a PPV, a positive predictive value, and it tells you what your risk assessment is before the blood test, okay? So what I'm getting at is this: I don't trust this test, and I know very well that my baby could very well have Down syndrome. I know that. So the test itself is very sketchy to me, and the reason why is because it breaks it down for you, and it tells you a PPP value, the positive predictive value, before your blood test. And mine, the normal like average in the United States, or just in general in the world, or whatever, the normal statistic is 1 in 500 and something, almost 1 in 600. So basically every 500 to 600 babies that are born, I think in the United States, has Down syndrome. So on average, you have a 1 in 5 to 600 chance. It's about, let's just say 1 in 550, right? Is the average risk assessed. But mine was 1 in 20. It was actually 1 in 21. So like a 20%, 19% risk for Down syndrome, based solely off of my age and my body weight. And I don't know if they go by anything else. I don't know if they have any other data, but literally I was high risk before I even got a blood test. So I don't know what the blood test shows. I just know I'm high risk, okay? So based off of their assessment of their algorithm, their PPV, their positive predictive value, I'm already high risk. So what immediately happens is you talk to a genetic counselor, and then you talk to a maternal fetal medicine doctor. And when I got the paperwork, I didn't know the gender. My brother crossed it out, and I saw the high risk. And I talked to a few friends, and they were like, yeah, I transferred a already tested embryo, but because of my body weight and my age, I got a high risk too. But they didn't know I had already tested my embryo. My doctor told me just disregard it. I had like 3 friends tell me this the day of. So this was like on July 2nd, and we were planning I think we got the results back on July 1. We expected it on July 2nd. We got it a day early. We were gonna do a 4th of July cookout. Okay? So what happened was, the day I found out, I talked to friends who, IVF friends, did the Nipt, all this stuff. And then when I talked to them, they told me, don't stress about it. Don't worry about it. Just see what happens. Like, you don't have to worry. It's probably not a thing. And if it is, you'll be fine, but just don't stress out about it. That was their best advice. I wasn't stressed out about it. Okay. And so on July 2nd, that's when I spoke to my genetic counselor. And that's when I spoke to the MFM on the same day. And so I'm going into a Zoom meeting with the genetic counselor. It is July the 2nd, and I've seen the test. They haven't. So I get on the Zoom call. My husband is not there. He's at work. I didn't think he needed to be there. For some reason in my mind, I just thought, what's the big deal? And I had already kind of told him, like I had already discussed with him, like what I had told him about the Nipt test. Like I had explained to him that Trisomy 18 and 13, real bad. Trisomy 21 Down syndrome, you're pretty good. So I get on the thing with the genetic counselor. She doesn't know that I've gotten my results. It's a woman. She's gentle. She's, you know, she's empathetic. She's compassionate, and you can tell. But she's also telling you stuff. And I told her I got the test results back, and she's like, okay. And I told her that we had a high risk for trisomy 21. And she just immediately was like, oh, I'm so sorry, and all this stuff. And I was like, you know, my understanding is that it's just a blood test, like it's not definitive. Like the positive predictive value was 1 in 21 before they even tested the blood, just based off of their algorithm, and it explains that. So I told her, I said I wasn't really freaking out about the Down syndrome thing until I got more information. And her basically, what she basically said, and she could be accurate, but she was like, these tests are highly accurate. I was like, okay. And she said, if it says your baby has Down syndrome, your baby has Down syndrome. And I was like, okay. So, and then she proceeded to let me know that the way she worded it was, she basically said, and this kind of like was probably one of the major things that really like clicked for me and like made me go down a dark hole, a rabbit hole. She said, if you've ever seen an adult with Down syndrome in the wild, or you know what I mean? She worded it something like that. She didn't say in the wild, but if you've ever seen an adult person with Down syndrome ever yourself, that you're witnessing a walking miracle, because people with Down syndrome are not supposed to be here. And when they do, it's a medical miracle. Most babies diagnosed with Down syndrome are not compatible with life. If they do go full term, they oftentimes die hours after being born. If not hours, sometimes to age 1 or age 2. They have to usually get intense open heart surgeries, sometimes multiple open heart surgeries, just to make them live. How is that a good life for any child? And then if they do live through that and do age and grow up, is not like you see on TV. Many of them are incontinent and are in diapers their entire life. Many of them are incapable of walking. Many of them are incapable of eating, are on feeding tubes, require nurses, round-the-clock care. And she suggested that I seriously consider the quality of life that a human being would have, and reminded me that it's not about me. And she said very kindly that she could tell that I was very excited and I already loved my baby. And if I loved them, then I would terminate. And the thing is this, I'm very neutral about things like religion and politics and like sexual identity. And I am not a judgmental person, and I don't think there's always like a certain way you should be. I don't judge people for their choices. I think things like religion and politics and your sexual identity should be probably private. And I don't have strong views on politics or abortion. Like I could go either way. Like it just, I'm not an overly religious person. Like I can't say for sure that like I would be lying if I said that like growing up in the United States in a Christian household, going to church and stuff didn't affect my thinking or indoctrinate me in some kind of way. Like I grew up in America, like I grew up in a Christian, my parents weren't even that Christian, you know, they weren't like religious. They just believed in like a religious education and stuff. And I went to Sunday school and stuff, you know, so I know a little bit, but like, I'm sure it influenced my thinking in a lot of ways that I'm not really aware of. But like, when it comes right down to it, like, I don't profess a political party or profess a religion. Like I just don't. Like I have my own view on it. So I'm not one of those people who is against abortion at all. I've never done it, but I don't fault people. And I oftentimes think like, I'm not the kind of person who looks at someone and says shame on them. Like I would never make that choice. I oftentimes look at things and say, well, if I were in their shoes and like I had gone through everything they've gone through and experienced what they've experienced, like chances are, like we're all humans, like probably would have come to the same conclusion they did. Like I'm probably not much different, you know? And I think people who take the moral high ground, like I think it'd be very easy for a woman who's 44 years old to easily say like, I'd never get an abortion. And like, I probably would never get an abortion, like probably never, you know, but it's easy to take that moral high ground when you couldn't get pregnant anyways, you know what I mean? So like, who are you to judge? Like, I'm not judgmental. So I even was saying all those things, I was really taken aback. It was jarring. There was something very like, literally the world dropped out of my ass. You know what I mean? Like, I can't tell you, like I literally went from super over the top happy, oh my God, I'm pregnant, to, oh my God, there could be something, but don't worry about it. Like, just don't worry about it. Like, don't let it stress you out. Like, that was the advice I was getting. Like, okay, yeah, let's just navigate through this. And then here comes Miss Doom and Gloom. And it just really, really threw my ass for a loop, seriously. And my number one thing is that, I think I explained this before in the, like, I think I used like smoking and the chance of getting cancer, like, you know, like you hear the statistic. So like when you're 44 and you're pregnant, you're like, you know that like older women have a higher risk of having a baby with Down syndrome. But when you hear it, you just like freak out. And then she tried to like basically like let me know, I never even knew that if you had a baby with Down syndrome, you could terminate it for medical reasons. Like, I didn't know that. I thought you just had a baby with Down syndrome. I didn't think you had the option of like aborting it just because I had Down syndrome. Like, I didn't know this, you know? So I was just like, what? And not only did she suggest it, like, we live in Texas, like it's not even legal here, you know, but like she like really encouraged it. And I get it, they're doctors, you know what I mean? Like they have a different viewpoint on life, you know what I mean? Like, this happens to them every day, you know, these things. So they're dead to it. They're spiritually, like, emotionally, like there's no emotional response. It's just science and numbers and reality. And like, but to me, it was like earth shattering. Like, it was crazy. And the thing is like, I read the test and it literally says that like it's an algorithm and it's based off of your weight and your height and their algorithm. And like, I really thought she would say like, don't trust it and like, we can figure this out and like there may be something wrong, we don't know, but don't worry about it. No. And she even recommended that there was no reason to even do an amniocentesis or any kind of diagnostic work because it is what it is. The test is accurate. Almost 100%, something like that. Like, she was just really bolstering up this test. And I was like, I couldn't function. And then like, so I kind of like lost my shit. I went into a little bit of denial there. And I was like, what is going on? How can this be? Like, what? And then I talked to the MFM and he was just as cold and careless and heartless. And even they have this weird way of saying it in this compassionate manner, it's very cold. And so he started rambling and talking, and I was just kind of frozen and just like, and he just basically suggested termination. And I said to him something along the lines of, okay, you're telling me that there's a 95% chance that my child has Down syndrome. And if he does have Down syndrome, then there's a 98% chance that he's not gonna live, or he's not gonna be compatible with life, and that this test is 98% accurate. And he was like, yes. And I was like, okay, so like, what do you suggest we do? And he was like, I suggest an amniocentesis. And I was like, okay, but there's risks with amniocentesis, right? He was like, yes. And the counselor had quoted it as 1 in 900. And then this doctor turned around and quoted it. I forgot if he said 1 in 5 or 1 in 600. That amniocentesis is literally a needle through your stomach where they pull a little fluid out and they test the genetics of the fluid, which can give them. So basically, the Nipt test is like a lot less accurate, I guess, or so he suggested amnio. So I said to him, all right, like, let me just see if I get this. You're telling me that there's a 98% chance that this test is accurate, that my baby has a 95% chance of having Down syndrome. So I should get another test that could kill the baby to find out for sure if the baby has Down syndrome. Like, I don't get it. Like, I just don't understand like what you're doing here. Like what is the logic? Like, logically, like if you told me, if I took a test and you told me I have a 95% chance of having cancer and this test is 98% accurate, but I can get a test that could kill me, but at least I'll know for sure if I have cancer. You know, I don't need and the amnio is 99% accurate. It's like DNA. It's like very accurate. So, that just threw me, like that whole logic of that wasn't really logicking for me. And so I basically just kind of said like, I told him, I said, I'm gonna schedule amniocentesis. It's called amniocentesis. I'm gonna schedule it. He wanted me to immediately schedule for this is the other thing too. He was encouraging me to abort immediately. One of his reasons is because right now I'm only 12 weeks. So they can, he said, I can't talk to you about abortion because Texas, but I can give you some resources and it'll be earlier. So it's better. I was gonna schedule an amnio, and this was even before I knew for sure if I wanted it. I was gonna schedule an amnio, and I was gonna he wanted me to schedule, here's another thing, okay? The doctor who just is promoting me to terminate, he's made it very clear, not directly, but indirectly, that he does not think there's a place in this world for people or humans with Down syndrome, and that they're very much, didn't really go into it being a burden for me, but like he very much expressed certain things that were definitely designed to, he compassionately, I'm not saying anything bad. If you don't want a child with Down syndrome, like you don't have to have one. Like I get it. Like I'm not saying this because of like religious reasons or anything else. I'm just speaking from my heart, right? So like if you choose to terminate for medical reasons because you don't want to deal with a kid with Down syndrome, like I don't care. Like it's okay. Like I'm not mad at you. Like I get it. Like I get it. Like I walked myself mentally through with this with me, and like I get it. So the thing is that the doctor who just made it very clear that he like doesn't think like they should exist. Like he hasn't said it directly, but he has made it pretty clear that he doesn't think there's space or a place or a function he just sees life as so like one-dimensional, basically. Is the same doctor who wants me to trust him to poke my stomach all the way through with a needle and just very tiny go into like the first membrane and pull it out, because if he even goes a little bit too far, he'll kill the baby. He'll pop the baby's sac and the baby will be born immediately. Or even if it's just like a little tiny hole they can't even feel, I will go into labor in a week or two. I don't trust this man to go near my kid. I was like, no. So I did schedule the amnio just in case I decided to get it. I hadn't even talked to my husband. I scheduled the amnio. It was like 3 weeks away. I was already 12 weeks. So my amnio wouldn't even be until like 14 or 15 weeks. And the anatomy scan couldn't happen until 18 weeks. So if I chose to terminate, my baby's gonna be like 20 weeks before I get the data, or at least 16 weeks. So like I have to carry a baby for a month and let it get bigger and bigger and feel it and then terminate it. So it's very distressing, all the options. And I went down a lot of rabbit holes and did a lot of research and learned a lot of things, and also went to some very dark places. And I remember crying every day, all day, because I think at the darkest point, I was like, I got all excited to get pregnant. For what? And like talking about it kind of like brings me back to that moment, so I might tear up a little bit because I'm hormonal. But I get all excited. And listen, at this point, I hadn't even announced that I was pregnant to anyone because I was 12 weeks. So I hadn't announced it. So nobody knew this little sweet baby even existed. I'm gonna get emotional. I remember being in the pool, and the darkest things I said was, I wished I'd never gotten pregnant. Like, I wish I'd never gotten pregnant. Like I just told my husband, I said, like, if anybody thinks that being infertile their entire life is hard, those people haven't gotten pregnant and lost their baby, because there's definitely harder. Like, regardless if, like, let's say you can never get pregnant, if you've gotten pregnant and suffered from lots of miscarriages, I am so sorry that you had to go through that, because it is so sad to just get that excited and then to just, for nothing, to lose it, just to suffer. And then, sorry guys, I'm just pregnant. And then the other thing is, like, I told my husband, like, I wish I just never fucking got pregnant. Like, I can't do this. Like, and then the other thing too is that according to the woman who told me that, like, the baby probably wasn't compatible with life, like, knowing that there was like a 98% chance that our baby wouldn't even ever be born, that was awful to feel that. And like, you just go through so much, you know, like, you just cry and cry and cry, and like, you do self-pity, and that's okay for like a little while, you know, you have to snap out of it, but you just kind of wonder, like, why? Like, you're already part of this club of women who can't get pregnant, right? Like, this club you never wish you were part of, but you're in this group. And now all of a sudden, like, you have this, like, what feels like just like, I don't know if it feels like luck or it feels miraculous or what it feels like, but like, you get pregnant for what? And then the other thing I said was, and the other thing too is, like, if you're 44 years old and you're living your life and you have a good life, and like, you just kind of like, you want a baby, you want to be a mom, but like, you know, you come to terms and you say, like, you know what, it's just not going to happen. It's not going to happen. And you come to terms with that, and then you find out you're pregnant. And then somebody tells you that, psych, not going to happen. Like, it's just really hard. And like I just told my husband, like, Like it was just awful. And then thinking about doing the amnio and like all the decisions you have to make. And then like the other really dark thing I told my husband, and this is like so sad, and I'm not suicidal or anything like that. I'm really honestly not. Like I've never had suicidal thoughts in my life. But I told my husband, I said, and also I just want to preface that by saying like I'm just revealing like some of the darkest shit you think when you go through this. Like I'm just putting it out there. But my feelings have changed towards even the most dire circumstances, and I'm going to get to that. But I remember being in the pool and like with my husband and just like trying to relax, and I just remember, and this is like in July, y'all. This is like after the hurricane. We canceled our 4th of July party. I was nuts. I went nuts. I literally was like crying all day. Like I couldn't. And like I told my husband, like when I was thinking about the timeline, like if we do the amnio and wait and we decide that we don't want a baby with Down syndrome, and like I'm just thinking 100 miles a minute, you know? And I told my husband, if I have to wait until I'm like 16, 17, 20 weeks to get results back, to know for sure if my baby has something wrong with it, if he's not compatible, I was like, I'm not doing an abortion that far. Like I can't do it. Like I can't, even me personally, like I can't kill a fly. Like I can kill a fly, but I couldn't kill a mouse. Like I couldn't kill a thing with a heartbeat, like alive. Like I can't do it. Like I can't do it. Like I can't do it. You know what I mean? Like the decision is already made for me. Like I can't do it. Like if I'm supposed to, or if I feel like I should, but this baby's gonna suffer. Like I don't feel like I can handle it. Like I can't be the one to choose that for my baby. Like I can't kill life, you know? And I didn't know what all of the options were. I hadn't really done a ton of like research as far as like other people's stories. And I just felt like I was gonna be stuck with awful decisions. And like the hardest thing, or the most darkest thing I told my husband, is that if I get to that fucking point and like I have to do something, like I'm jumping off a fucking building, like I'm dying with my baby, like I'm not doing this. And it was just really awful, and like the shit you think, and like it's just very bad. Like it was crazy. But like it's hard. So my thoughts and mentality did change, okay? So I'm gonna talk about that. And so what I will say is that I'm gonna give you some ideas of some of the things I thought of and how I processed it, and maybe this can help people, okay? Because like I'm good, but it was hard, and it's life-changing to go through that. It is really rough. Like that is a rough road to hike down. And like the best thing is this, like you're not alone. Like you're not alone. And I'm gonna tell you what helped me process through it. So the thing is this, we did not get the amnio. Like I've already said, why? Like we know the stats, and I like to be in numbers and a math person, but at the same time, like the anecdotal stuff we saw was like, it is too weird that we see 2 people and talk to 2 people. One of them was the nurse at our hospital. She looks like Dionne Warwick. My husband is in love with her, and she's so sweet. She's like the only black woman in the office. My husband just really gravitates towards her. And she said when she was like 25, she got like an amnio for some high risk stuff. And I don't know why they gave her the amnio, but it caused a spontaneous labor. She had the baby a week later, and the baby was healthy. So there's that. So these anecdotal things, she's a doctor, she's a nurse, she's an RN or whatever. So she, you know, she's not making this up, and it happened to her. So she didn't even warn us. She just say, don't do it. She didn't say anything like that. She just said it happened to her, and it does happen. So it's rare. But the other thing too is that I could not trust the doctor to do that, especially not that doctor. Like he doesn't even want Down syndrome people on this earth. It was very clear. So number one, I wanted to say this. I feel like I am slightly still in denial, right? Because I didn't get the amnio, so I never got a definitive answer. So I really thought by now we would have some markers that would confirm, so I could know, so I could relax in the knowing. I'm still slightly in denial because I don't have an answer. So while I know there's a good chance our baby could have Down syndrome, there's nothing definitive to make me accept it. And some people would, even I can recognize that I'm slightly in denial here. My husband is a lot in denial. He just has his way of thinking, and I hope he's right. I hope our baby does not have Down syndrome. And I hope that he doesn't, and I know that kind of sounds awful, right? Like someday my baby might see this video and he might very well be raised with Down syndrome. So like that makes me feel like shit, but like nobody would choose it, you know, like nobody would choose it. But it is what it is. And I'm gonna stop being a self-pitying little biatch right now. But what I will say is this is what I did. I did a lot of research. I would tell you this. There's a couple of resources if you do get a Nipt test that's positive. There is one called The Waiting Room on Facebook, and it's the waiting period between the Nipt and between the amnio, right? So we chose not to amnio. So we have to wait until birth to confirm if our baby is healthy or not. Like healthy, like you can have a Down syndrome baby who's very healthy. It could happen. So we have to wait for our results. And if I'm not being clear, I might be over explaining, but I might be under explaining, like ask. Join that group. It's a really good group. Like you can't go in there unless you have a positive for something, and people share stuff. Another thing is the Nipt Reddit. I don't know who runs that group, but that person who runs it has got to be a doctor. Like it's amazing, like their data and stuff. So their resources, it's top tier. So it's definitely a doctor or a nurse or somebody in the embryology field or something like that. So yeah, my whole family's in denial. Like I've told the family, they just like, yeah, like they just say things now and again. Like if I say something like, if my baby has Down syndrome, then I'm definitely homeschooling. Or if I say like an offhanded comment like that, they're like, so you think the baby has Down syndrome? And I'm like, it's not about if I think it, it's about tests. You know, I'm just like, I mean, we don't know, but like I've explained to them the test, but it's hard to absorb this. It's really hard to fathom or grasp, or it's really hard. And like you go through like a literal grieving, You think about every single thing, like your kid liking girls or getting married or having a girlfriend or getting a job or a license or anything. And like, you think about everything and you grieve all that stuff. And it's really hard. But, the good thing is this, my husband, like the good thing is he doesn't give a shit. Like he wants the baby no matter what. And he would be such a good dad to a baby with special needs. Like he is so patient and kind. And like, I'm the impatient one who's gonna be like, oh my God, this 5-year-old can't tie their shoes and get annoyed, but he will never, you know, like he's so kind and sweet and he has unlimited patience and sweetness, and he never, ever, I get irritated and frustrated and let it out, and he doesn't. So he's gonna be great at it. And he doesn't believe the baby has Down syndrome, and his reasoning is really cute. Like he says like, well, you weren't supposed to be able to get pregnant at your age, and you did. And we always wanted a boy, and it's a boy. There's no way it could have Down syndrome, and that's what he thinks. And like, I'm just letting him think it. And the thing is like, if he sees me researching anything about Down syndrome, he tells me don't, because I'm manifesting it. I was like, dude, if I had this kind of powers, we would have already been pregnant years ago, and then we would be millionaires. We would have won the lottery long, long ago. So there's that. So anyways, I know I'm all over the place, but just bear with me, okay? So things that help me process it. Number one, the waiting room on Facebook, the space between Nipt and amnio. Let me tell you something. I will never trust the Nipt, ever. And even if my baby is a boy, that's been confirmed, and the test said boy, and he very well may have Down syndrome, and I'm fine with that. But there is like every 10 to 20 women with a positive, it's false. Like, I'm not shitting you at all. And then I kind of researched like the statistics around the false positive with the Nipt test, and they say they're 98% accurate, but because of the quantity and the basic math of how many tests they do so many now, it's like 1 in 20 is false. Like, there's no way. Like they have a lot of false positives. Like 1 in 20 still is not that bad, but it's not that high, but it's still like a high risk of false positives. So I swear to you, if you go look at anecdotal stuff, when you read like this is happening, like every 20 women who get it was confirmed actually positive, you get a false positive. And it's crazy. And there's so many nuanced things in there. Like I don't want to get too into it. I will in a minute, but there are false positives, like for sure. Like things that cause false positives, if your weight is higher, if your age is higher, if your fetal fraction rate, like mine I said was like a 5.4, I think. If it's lower, like if it's under 10, there's all these different things. And I was high risk regardless of the blood test. Like I was already high risk. Where they got the 95, I have no idea. But I don't really know how the science of it all works. But I'm not like in denial as in I don't think it could happen. I think it could be accurate, and because of my age and stuff. But we shall see. And if it is, it's fine. Like I've already accepted that, and I'm fine with it. What else am I gonna say? So basically, join those groups. There's some good data. Stay positive. If you choose to terminate, it's okay. So basically, my journey through the Nipt test went like joining those groups, and then I learned a lot. There was a few women who were my age who got false positives, who the amnio said that it was wrong and they were negative for Down syndrome or whatever. There were a lot of young women who had false positives for T13, T18. The more T21 was older women, and there were false positives. And then I don't think that the genetic counselor or the MFM doctors, especially the genetic counselors, I don't think they really necessarily received the data to see the false positives. Like I immediately switched my MFM doctor. I did not see him again. I disliked him immensely. Dr. Doom and Gloom, I was good with that. Also, I went to a doctor appointment with my regular OB, and he confirmed with me that like, just because your baby has Down syndrome, like you're already past 12 weeks, like it doesn't mean you're gonna miscarry. It doesn't mean that your baby's not compatible with life. Like he was like, that's very antiquated. Like if there is a heart problem, it can be fixed. Like he was like, yeah, some babies aren't compatible and it's really sad, but he said some babies that are totally chromosomally fine are also incompatible, and they have no hands, or they have it, that's not chromosomal. Like I don't know why your baby would be born with no hands, and it probably is genetic something, but like he's like, you can't test for that. Like he was just giving me these anecdotal stories, like you could have a baby that's totally chromosomally fine and doesn't make it. Like he was like, this is antiquated. The stuff they're telling you is antiquated. Like when I was confirming the baby only has a 98% chance that if he has Down syndrome, he's not gonna make it. He was like, no, that's fine. He's like, I have friends who have a 10-year-old now who has Down syndrome, and he's great. And you're gonna have a baby, and like your life is not over. Like it's gonna be different. And he was the first one who said that, so, and then, I really had to think about what he said, because the truth is like, whenever you get pregnant, it's a crapshoot. Like you just don't know. Like you could give birth to a totally healthy baby and it's just an asshole or a serial killer or ends up a drug addict who stresses you out your whole life. Nobody signs up for that shit either. And then also, there's no way of testing for other things. Like let's say, for example, autism. Autism is a spectrum disorder, but you have a perfectly healthy chromosomal baby, and then all of a sudden, like the baby has autism and is low functioning, and you have a baby who lives with you their entire life and is has a disability, and it is what it is. So it can happen with chromosomally normal children. So that made me feel better, because it made me realize, like, Down syndrome or not, it's a crapshoot. You just never know. There could be heart defects on a perfectly chromosomally normal baby. There could be, when I say chromosomally normal, you know what I mean. not try to be heartless or anything. Did I say this is decaf? It's decaf, in case you're wondering. But it just, you know, it throws you for a loop, and then you start processing. What I will say is it throws you for a loop, and then slowly you will start using your brain to process. So it's really bad at first. I said I was gonna jump off a building, me and my baby. Like, I'm not boarding my, like, that's like, you know. There was one lady who diagnosed Down syndrome and did not get the amnio. No, I'm lying. She did get the amnio, and I think they had mosaic. When you have Down syndrome, T21, you have an extra chromosome on the 21st chromosome. So instead of 2, there's 3. That's on every single cell in your body. When you have mosaic, it only affects partial of the baby. So she was like around 60% Down syndrome, but by the time they had the baby, it had self-corrected to 12% Down syndrome, meaning the baby had no facial features of Down syndrome. They don't know what the implications of that would be, but there are people and walking around that, and up until like 10 years ago, there was no Nipt test. Up until 4 or 5 years ago, you were only even offered the Nipt test if you were over 35. It's all new. This is all new. There's a lot of implications that aren't being weighed. There's a lot of things that are gonna happen, and it's very sketchy, and I couldn't live with myself. Like, I couldn't live with myself. Like, I'm too sensitive. I can't do that. But we'll get into that in a little bit, but there's a lot of things that the Nipt test is doing that is very sketch. And, you know, I'm not gonna lie, there were people who, there was a couple, they were 24 years old. I don't know if the woman had abortions previously, don't know, don't care. Like, it's not a judgment at all, it's fine. But they got 87% Down syndrome chance, like high Nipt, like they got a high risk on their Nipt, 87% chance baby had Down syndrome. They were given like a date to do the amnio. They were given like all these appointments. They just said, fuck it, let's just go do a TMFR. TMFR means terminate for medical reasons. And it still kind of baffles me that that's for medical reason, but whatever. And they went and did it, and they're not, it's really case by case and like patient by patient, but whatever their mentality, their brain, their mindset, they went and did their abortion. And then 4 weeks later, because I think they were at 12 weeks when they just said, fuck it, let's go. They're 24, like they had no kids, like fuck it, let's go terminate. They went and terminated. 4 weeks later, found out the baby was healthy after all, but they were fine. They were just like, they knew the risk, and they accepted it. As long as they're happy with it, I'm happy with it. Could I have lived with myself? No, but it's not my story. You hear all these stories. You hear a lot of false positives, not a lot, but you do hear them. Also, there's a woman with twins. They suspected that one of them had it. They were both fine. Some people go to birth, like the woman who had the mosaic, who came back to say, I'm just coming back to let you guys know. I came up positive for trisomy. When they did the amnio, they detected it was mosaic, which means not all the cells have the Down syndrome, and they came up with like 60%, and they didn't know because they knew the number could change, but the baby was only born 12%. And then another thing too with DNA is that there are people walking around who are completely normal looking, look just like me and you, look, speak, work, just completely normal functioning adult, and they have mosaic Down syndrome at 3 or 4%, and like we just never could test that before because we didn't really know, and this wasn't a thing. You couldn't really map out your genome before, but it's relatively new. You know, it has to do, the same test that does the Nipt is the same one who tested your embryo. There's only a few companies in the United States who are capable of doing it. I know Cooper Genomics did our embryo. This one was Natera. It's called, oh God, I forget what it's called, but it's called, it starts with P, I think, but it's by Natera, is the people who test it. Oh, Panorama is the name of the test. So the company is Natera, the name of the test is Panorama. And I know Cooper Genomics also does it. It's the same exact technology. Natera is supposed to be the better one. There's another one called Maternity that's checking for trisomy, so how clever. And I just will let you know, they're trying to find the genome for autism. So yay, they just really don't want anybody different or weird or unique or special. Just kill them all, you know, like I have an issue with that. Like also, just so you know, like if you go to like Iceland, there's nobody there who has Down syndrome. They kill 100% of the fetuses that are diagnosed with Down syndrome. There are a couple, like 5 people living in the whole entire country with Down syndrome, but they mostly moved there or whatever, but it's really a big push. I know a lot of insurances still will not cover a Nipt test if you're under like 35. A lot of insurances won't cover it. If you want to pay for it, it's $3,900 out of pocket. Ours is definitely covered because I'm 44, but a lot of younger people are wanting to get it and they will pay out of pocket for it, and they're going to terminate their pregnancy because they want to know. And I get it. You don't want, like, you just don't want an imperfect baby. Like you have these dreams of them growing up one day. And I get it. Like I totally get it. Like I've gone down the road and thought about it. Like I get it. I don't blame anybody for wanting that. Another thing I've noticed is like I also went on Instagram, looked up a lot of accounts of babies with Down syndrome, and people, they have very low followings. Like it is not a popular following. Nobody wants to see that shit. They do not want to even, people just pretend like it's not real. And if you have a baby with Down syndrome, you're part of a very supportive club, but that too is very sketchy for me because they act like they call themselves the lucky few. And I just feel like that is just like, it is so corny to me, and I'm just gonna have a really hard time, but I'll figure it out. The other thing that really, really woke my ass up, I'm gonna put it like that, is I went through that whole dreary doom and gloom, cried and cried and cried, and literally it was a lot of self-pitying, you know what I mean? And this is what helped me snap out of it, was a few different stories. So I don't know in the order in which I process these stories or watch these stories, but what I will say is going through the Nips and the YouTube stories, there's a few women who come on YouTube and they come on there and they are in the midst of it. Like I could never, you don't want to see it, but they come on their video and they're just like, we just got a positive for name your trisomy, 13, 18, or 21. And the way they're talking, they're exasperated. They can't even catch their breath. We just got a thing, we got trisomy 21, like we don't know what we're gonna do, like we're so upset, like here's our plan, and then we're gonna do this, and we're gonna do this, and we're gonna do this. And so I'm watching these stories around the early July time, 3-4 days into knowing. And watching these stories definitely helped me, because there was a girl would come on and her video would start out, and then usually in the same video, she would have like, this just happened, we got this result, we're heartbroken. And like the way she's talking, she's literally like out of breath because she's so emotionally distraught. And then it'll flick to the next one, like today we're gonna go do our amnio and we're so stressed out and we're just not, and it's just like, you know, and like it usually takes like, it's a series of short clips between the Nipt and the amnio. And that's like 4 or 5 weeks, and sometimes 6. And it just depends, but if you go from 10, and like you can't do the amnio until like 15, 16 or something like that, 14 maybe. Also, there's another test called a CVS, which I wasn't even offered because I was already past, sorry, my dog, a certain amount of weeks. So when I watched these videos, there were several of them, several different girls who never met each other. And it was the same feeling, the same vibe, the same panic. And my brain said to me, they are in the same boat as me, right? They start off like, I know that feeling, that exasperated, like can't breathe, like what am I gonna do? Like the thing is like at the end of the day, there's nothing you can do. They did all of this shit, all this worry, and the result is the result. You cannot fix it. There's nothing I could do to fix it. There was nothing I could do to fix my baby. My baby has Down syndrome or does not, but there's nothing I can do to change it. Like, it is what it is. Like, I just don't know what it is, but this intense worrying is not going to change nothing. It's just going to make me not enjoy my pregnancy. It's just going to steal my joy. And I had never been pregnant, and according to my doctor, who I had an appointment, said, you're still gonna have a baby. Unless there's something else going on, you're gonna have a baby. It's gonna have Down syndrome or it's not, but you're gonna have a baby. That made me feel a lot better, right? Because that was my number one thing, like losing the baby was the hardest part. And these women, watching them go through this, it's not changing nothing. You cannot change anything. And I just, it flicked a switch for me. And I refused to be this woman. Like, I'm not gonna panic. And they were doing so much, so many appointments, so much research, and this and that. And don't get me wrong, I'm doing a lot of research. And I'm still gonna do it. But I'm not gonna panic. I'm going to accept it. I'm just gonna deal with it, okay? So that helped me take a deep breath. So those are a few things that's helped me, right? Number one, realizing that it's a crapshoot. Doesn't matter if your baby has a chromosomal abnormality or not. There could definitely be something wrong, right? Maybe the odds are in your favor. Most likely it's just gonna be a normal, healthy baby. We see normal, healthy babies be born every day, but there's a lot who's not. There's somebody in my over 40 pregnancy group, baby, ultrasound, no hands. Baby's gonna have no hands. If they choose to keep the baby's not gonna have hands. What do you do then? There was nothing wrong with your chromosomal test. You know, it just happens. It's a crapshoot. Are we gonna give birth to an asshole? I don't know. Who knows if they're gonna be productive members of society or whatever? Who knows? That helped me reframe my expectation of what giving birth and pregnancy and babies, the expectation for them is. Watching other women panic made me realize that all the panic in the world, it can't change jack shit. And so I'm gonna sit my ass down. I'm gonna try to, I couldn't lie to myself and say I was gonna enjoy my pregnancy at that moment. Like, I was still early on, but that made me relax. And then I happened upon a video, because I just looked up like Down syndrome, pregnancy, Down syndrome, this and that. Watched a lot of videos. Now I had to watch when my husband was at work because he's like, don't watch that. You know, he's still in denial. I'm gonna lean back because I'm tired. But I watched the video and there was this couple. I'm pretty sure they were like a Christian couple because they were very much like, I don't remember for sure, but I think they came across as pretty anti-abortion. And they had a baby with Down syndrome, but he had some pretty intense medical problems. And they carried him full term, and they gave birth to him, and he had a heart surgery, and then he struggled, and then he just struggled, and he suffered probably, but you know, I don't know if he actually suffered because he was in the NICU. And there were some days when he looked like he would come out of it. There were some days that he looked like he would make it. And there were some days when he wasn't doing so good. And I think he went through a couple surgeries and lasted for a little while. And then they just decided, like, you know, it's time. They went to the roof and they had this thing where they sat there with the baby and loved on him and they let him die. It's heartbreaking. That was heartbreaking. And you question whether or not it's the right thing to do, but you have to make a choice. And then I found the TMFR support group. If you ever want to know, and this is just my experience, this is just me, but you know, traditionally when you're a kid and like you go to church and they teach you about like hell, like literal like damnation, like hellfire, brimstone, like lava, you know what I mean? Like people burning to death, like that whole image they conjure up. Now, I don't know if I believe in hell or not, it doesn't matter. But you know what I'm talking about? Like ultimate suffering. Like if you ever want to know what it probably feels like to not be sent to hell for being a bad person or whatever, but just to walk through it, go to the TMFR support group. Now, this is just my experience. There are a lot of people who, in the Nipt waiting room group, there's a lot of people who say, if you need support because you're going to do a TMFR, come over to the TMFR support group. They're great. Yeah, I went over there. They're great. there's so much support. But if you want to read stuff that is the most god awful suffering you've ever heard of, go read it. Because I didn't dig. I literally just read, like, it was late at night. It was like the first week of July, somewhere after the 4th of July. I've been crying every freaking day. And I'm in that group and I'm reading. And like I said, I'm not digging. And the energy of, like, let's say you're in the Nipt group and it's a woman. She's writing a blog. Oh my God, we did this. We, like, this is our history. Like, we went and got the Nipt. Like, this is so awful. Like, I don't know what to do. It's suffering, right? Like, it's sad. You go over the TMFR and it is literally longer written. It is so much more filled with pain. And like the first one I read, a long one, a man, and literally, like, I'm telling you, the writing, the shit you read, it is the most, it's literally like walking through what hell would feel like seeing people suffering in hell. It's literally their own hell. And there's a man on there who is like, I don't want to live anymore. I can't stand my life. I can't bear to breathe another breath, like, because I killed my daughter. And it's like this man, like, talking about their baby girl that they were pregnant with, and he just remembers, like, how happy they were, and he's just documenting stuff, right? And I'm crying because it was just the most god-awful shit I've ever read. And he's talking about how their baby came to be conceived and, like, the steps they went through and finding out they were pregnant and falling in love with her. And she had a name. Her name was Sarah. And they found out through the Nipt that she had a rare disease with her bones. So cognitively, she would be totally normally healthy. She wouldn't have a developmental delay, so she would be very aware of her physical condition, whereas some of the ones with developmental delays, for example, Down syndrome, will they even know they have Down syndrome? Probably not. You know, they just live their best life. But Sarah had a genetic something that messed her bones up, so she would never stand upright. She'd probably always be in a chair. It would be very hard physical therapy. She would be definitely suffering. It would be a hard life for Sarah. And so him and his wife, you know, they did this thing. I found out that most abortions through this studying I did, they basically terminate the pregnancy. And I don't know how they do it. I guess it's a pill or a shot or something, and it kills the baby inside of you, and then you deliver. So he just remembers feeling Sarah kick and holding her and kissing her through her mother's stomach, and then they gave the mom the shot or whatever, and then he felt the baby die. And then they induced the labor and she was born. And he hated himself for it. Like, he doesn't regret doing it because it needed to be done. But he hates himself and he just will never be the same. And, like, it was just the most saddest thing ever. And, you know, I asked him, I said, would you change it if he could? And he said no. Like, he wouldn't keep her alive because it would be selfish of him, but he just didn't want to live no more. Like, he couldn't. And, like, I just can't imagine living your whole life wanting to, like, off yourself, you know? It sounds horrible to live that way. And then there was another woman who, she got diagnosed with a trisomy, and I don't know which one it was, but she had like a 30 or 32 week termination for medical reasons. And I think she had like the Nipt, and I don't know if she did the amnio or not, but they did it. And like, I don't remember exactly, but I just know that she said that whatever trisomy it was, one of the markers was a cleft lip and no palate. And so they terminate the baby the same kind of way where they there's some way, I don't understand abortion, but they kill the baby. They ceases to live. Like, life is gone. It's still inside of you, and then you deliver. So it's painless to us and, like, hopefully to the baby, but the baby's heart stops. And then she birthed the baby, and they were very sweet. Like, she went into labor delivery. They treated her just like she was gonna have a baby. And then they passed it to her, and they passed her daughter, and like her palate was fine. And she opened the baby's mouth and she was touching the baby, and she said it was the most beautiful thing she ever seen, and there was nothing wrong with the baby. It's awful. And then the last one I read, and that woman was suffering. She was just talking about she lays in bed every night and she cries for her baby. And that was so sad. And the last one I read, and I'm telling you right now, I didn't read every single one, but I didn't dig for these. These are not the most worst ones I dug for, and I'm picking. I was in that room for maybe 20 minutes reading these 3 or 4 things. And then the last one I read, same situation. But for whatever reason, I think she was younger, so she didn't do like the Nipt, and it was just like through ultrasounds and stuff, they figured out something was wrong with the baby. So she decided to terminate, but she was very far. She was very far. She was like the furthest along. She had to be like maybe 32, 36. I don't know. Feel free to go into that room and read them if you want to. I will never step foot back in there. But she went, and same thing, same process where they, the life of the baby is cut, meaning the heart stops. Peaceful, like I said, no pain, nothing like that. And then they induce you into labor, and the baby comes out. Well, I don't know where she was. I don't know what state. I don't know how they do it. When she gave birth, hers wasn't like the other woman's. They had a bag, a clear plastic see-through bag that the baby was born into, dead. And they had the bag, and she swore she could see the baby moving. And she said she saw the baby moving, and she said she questioned the nurses, like, why was the baby moving? And their response was, it's just the change in temperature making the baby flinch, but the baby is not alive. And the thing is that it's horrifying for me to imagine living without. Like, I'm so glad I went in that room, but I will never venture back in there. And it helped me make my decision, because it helped me make my decision for sure, because I cannot live without any of those things. Like, TMFR, I realized was not, up until that point, it was an option for us, right? Like, we're thinking about it. Like, do we want to do this life? Like, do we want this life? Like, let's really think about it. My husband never ever considered it. I did. But he was just like, no, we're just gonna have the baby. Like, it is what it is. Like, he's very, like, I love that about him, but he's just very, like, doesn't overthink shit. You know what I mean? Like, oh, our baby has Down syndrome, Down syndrome. We'll be fine. We'll be fine. Like, it's reassuring, it's great, like, it's sweet. But, I considered it for sure, because it's definitely an option. Like, it's an option. It really is an option, regardless if you want to do it or not. It's an option. I bet there's people out there who are pro-life who've had one. You know what I mean? Like, maybe the reason they're pro-life is because they had one, honestly. But I could not live with myself. Like, I could not live with these outcomes. Like, I couldn't do it. Like, I don't want to do it. Like, I couldn't. And they spoke sense into me. And like, just like when I was going through infertility, and I thought it was like the worst. There's worse. Oh yeah, there's way worse. There can be way more shit wrong with your baby. Like, it gets way worse. Like, that's why I stopped feeling bad for myself, because I stopped thinking that Down syndrome was like the worst shit that could happen in my life. Like, life can get way, way worse. You can go through worser things. And that's just how I kind of deal with it. Like, I just was like, I'm over here crying about my baby could have Down syndrome, but like my brother's friend, she was like 19 when she had her baby, and he was chromosomally healthy, and come to find out had leukemia. Went through a long battle with leukemia. That's very, very awful to have to deal with, and it's always a crapshoot. You just never know what's gonna happen to your baby, and like, it is what it is. Like, you shut up and you deal with it, and like, that's just how I'm gonna process it. That's how I'm processing it. Like, I'm not gonna, like, I get it, it's gonna be different raising this baby if he does have Down syndrome, but like, fuck it, there's worse things that I don't want to go through. So I'm gonna be real grateful if that's all I have to deal with. Like, it just perspective wise, put things into a different perspective for me. And I decided right then and there that I'm riding this out, and I will not be the decider of whether or not something survives or lives. I will let life do what life does, and I will cope with it just fine. I don't want to live with regret. Like, I don't want to live with any regrets. I don't have many or any regrets. My dogs. And I don't want to live with regrets. Like, I cannot. Like, I have to have a clear conscience, and this is just me and who I am, and everybody else is their own thing. It's a long ass video. And there's what I want to end with is like, that's just the conclusion I came to. Those are the resources I used. These are the things I watched, I consumed, and I just kind of processed it out. So now this is where we're at. So I don't have an answer for you about the definitive diagnosis of our child, but all I know is I'm very grateful. I'm having a great pregnancy, and I love my baby. And I showed the picture of my baby in another video, and this is him. He is a boy, and his little face is so cute, and I'm gonna love this little motherfucker no matter what. And like, it is what it is. And honestly, another thing I kind of told myself is like, I kind of imagine this scenario, like if I were standing in a line with a bunch of other women, and like God was standing in front of us, if there is one, right? And he says, okay, one of you has to get the baby with Down syndrome. Like, it's just the rules. I wouldn't pick the baby with Down syndrome because I desperately want a baby. Like, if we're all getting a baby, and we all know that, I wouldn't pick the baby with Down syndrome because I am so desperate for a baby that I would pick one with Down syndrome. Like, that never would enter my mind. Like, if I had a choice, like obviously, like we got our embryos genetically tested, so I wouldn't implant one, you know what I mean? I wouldn't choose it. But if I were in that line and I knew there were going to be children dispersed onto all of us, one thing I know about me and my husband is that, I'm gonna try not to cry, for the sake of the baby with Down syndrome who's gonna need extra, we can handle extra. We can handle a lot of things, you know what I mean? Like, we are not soft people who are just gonna like evaporate if something is hard. Like, we do hard things all the time. Like, I spent the last 2 years living in a renovated house. It was rough, you know? So I don't think life is supposed to be easy. I've never thought life was supposed to always be happy, and I never thought life was supposed to be, it's just not supposed to. Like, I just never believed that life was supposed to be, but I don't think that makes it unhappy. Like, I just don't think that. Like, I just think like our life will be different, our life will be harder. There will be occupational therapists, speech therapists, physical therapists, maybe possibly surgeries. It might be harder to teach our baby how to potty train or eat or walk or whatever, but guess what? If anybody can like do it, it's gonna be us. And the thing is, we also are able to balance, like, we don't feel like we need to like make him smarter or more capable to be more valued in society. Like, we don't really give a shit about that stuff. So we're very non-judgmental, and we understand balance. Like, yeah, we want him to be functioning and do great things and have a happy, healthy, like great life. Like, but we also aren't gonna like force it to like where he's like extraordinary human. Like, we really just want our baby to be happy. Like, normal chromosome baby or not, it's not like you have to achieve something to be valuable. No, just be yourself, be a good human, and that's really what matters to us. So when I visualize this like distribution of children, my heart would break if a baby who needed extra special care went to somebody who couldn't provide it. So if anybody is a tough cookie who can do this, it's definitely me and my husband. So it is what it is. It's hard. I hope this helps somebody. I know I'm emotional, but it's just pregnancy hormones and like the reality of it, you know, but like, it is what it is. I'm so grateful. Like, I don't feel ungrateful for this baby. Like, I feel so grateful, and I've had such a good pregnancy. And that's another thing. My husband's like, it's been so great. Like, nothing can be wrong with this baby. Like, nothing's wrong with him. Like, he's perfect, and he is perfect, and he's gonna be perfect, like, regardless, you know. Like, we're just so excited to like meet him. We're like now closing in on 6 months. Like, we're closing down towards the end of our second trimester. Like, pray for us that nothing happens with my health. Like we know that preeclampsia and like your placenta has to stay healthy. So we're just praying for health and all this stuff. I hope this helps somebody. I don't know if it did. This is how I processed it. Like I'm definitely, thank God, I'm able to like enjoy my pregnancy. Like we are able to celebrate. Like I'm getting ready to do my nursery. We're getting floors done very soon. All new floors. There's a lot of projects like I'm planning on like making this mirror look a little more like country, like farmhousey. Like I'm gonna do black grid over it to make it look not so 1990s. So I have a lot of little projects. That's it. Yeah. So just pray for me, pray for my baby. He's in good hands. Like he's gonna be great no matter what. Like I'm just emotional. Okay, guys. Bye.